Hello, my name is David Caldwell, and I'm Executive Vice President with Certify Data Systems, which is an interoperability company in the healthcare information exchange space. I think it will expand. I think all the things are ripe in the marketplace given what needs to be done in healthcare, primarily around the financing of healthcare and the new models that are being promulgated, like accountable care organizations. So I think certainly it'll expand based on that. Clearly, we're behind other industries in the ability to share information across various sites, and we need to take better care of our patients. So I think it's only going to expand, and I think as I talk to CIOs and healthcare IT folks, they all are, it's top on their list of priorities. So I think we're going to see a lot of growth in 2013. Oh no, certainly not. I think they've struggled to find their niche in the marketplace, largely from a governance perspective, as well as funding, kind of what's their ongoing business model, because they've had a lot of initial funding from the federal and state level. I think they need to find their way with the private HIEs and the enterprise HIEs there, and I think there's a role for both of them to play, because they really do have the public's interest in their hearts, and I think they're going to be very much a part of the landscape. Wow, we could talk an hour on that topic, but I think probably the most actionable one is access to a full longitudinal clinical record. So really making sure you've got a complete picture of the patient for the caregiver, so then when someone presents themselves for care, that clinician actually has a complete picture of the individual, whether that's in an emergency room situation or at your primary care doc or at a specialist. I think that's the immediate. I think right after that is the ability to identify gaps in care, or really to help kind of in the wellness area, to focus on a patient's wellness, to prevent or even to keep disease at bay. Ooh, that's a tough one. Well, it's called consent, and it's pretty straightforward, I think. First of all, having the right technology platform that manages the security, and obviously there's been a lot of breaches in the industry over the last few years, which has a lot of people nervous. So obviously the right technology, the right systems in place to protect health information, but I think more importantly is managing the consent and doing that on an individual basis, or really where the patient goes for their care, rather than trying to do that in one big centralized location. I think we can get privacy controlled better at the clinician level. Well, it isn't an empty buzzword. It's truly something that I think we're all striving for. In fact, the ONC is talking about now how we need to move from health information exchange to interoperability. That HIE is just the beginning. It's the mechanism or the tool to get us to interoperability. And so I think there really aren't any scams. It's just I think people need to be asking the right questions. So when somebody says HIE, that does not mean interoperability. And you really, the folks that are considering technology, using health information technology to improve patient care and share clinical information for lower costs and better care, need to be asking about, does it really provide interoperability? Can two disparate IT systems connect and use the information in their own native systems? And I think that's what will show that interoperability isn't as prevalent as some people think. Well, I think we touched on this a little bit. I think it's a bellwether year for it. I think there's a convergence of the payers playing a very large role in this marketplace, as well as the demand continues to steamroll down the tracks in terms of IT professionals needing health information exchange, with a focus on interoperability and how are we going to get there. I think everything is pointing to growth in this marketplace, from everything from Obamacare, if you want to look at it on a global perspective, all the way to us better managing the care and the cost of care, because we can't do those objectives without exchanging clinical information. Well, I think there's a lot. I think confusion in the marketplace about what's the appropriate tactics to take. I think Right now, both public and private health information exchanges are struggling for their place in the marketplace. So I think a constraint there might be that I think some people are waiting, sitting on the sidelines, and they're waiting to see if their public HIE provides the services versus starting their own enterprise health information exchange. So I think that's a constraint as well. So I think there's a variety of things that that could potentially slow the growth, but there's also fighting forces on the other side that are going to help to expand it. It'll continue to grow. I think as healthcare gets more comfortable with data somewhere else and managing that information from afar, I think we'll continue to see health information exchange and kind of the deployment of exchange systems and platforms cloud-based. I think it's a natural evolution of what's out there. It won't take away from some of the deployment requirements to make it efficient and effective. And in some cases, edge servers and physical hardware have been very important. But simply as a means for exchanging information, not necessarily for resident data to be resident. So I think we'll continue to see cloud expanding. Well, first of all, take a lot of time in discovering what HIE platform you want to use. Ask a lot of questions. Talk to a lot of others that have gone down the path. Learn the lessons. A lot of health systems have taken on HIEs over the past 2 to 3 years, and the technology platforms have not worked for them, and they're now scrapping those investments and starting all over again. So I think talk to your peers, understand what's really worked, make sure that you press interoperability and you understand that you should be looking beyond just the ability to view clinical information. It actually ought to be actionable in your own native system. And I think those are the things that CIOs and the people that work in their organizations, they need to start asking those questions and look very carefully at those investments. Yep.